When you look at, you're talking about the benefits, obviously, having an immune response and B cells and T cells and all that kind of good stuff that you would get from a vaccine. But, I believe a lot of parents might be asking the question, well, what about then unmasking our kids in school? And, we heard from the CDC last week when they were kind of laying out how they were going to be able to administer this, saying, no, that's not going to happen.
Yeah, Elizabeth, I think that was a real blow to parents' confidence and hope. And frankly, I think it's going to hamper parents' motivation to get their child vaccinated if they think their child, once vaccinated, still has to mask. Masks have been an important non-pharmacological intervention, but they were always meant to be a placeholder, if you will, until people were immune, whether or not they were immune because of the vaccine or because they had the virus themselves and developed natural immunity, which is, a controversial topic, but does exist. So, I think it's very difficult for parents, particularly as we've just seen the American Academy of Pediatrics and other major organizations declaring a national state of emergency for kids and mental health. We need to be very, very clear on the eve of the rollout of this vaccine that there are real harms for kids and for anyone, frankly, of interventions and restrictions from the pandemic itself that, in my opinion, should be lifted with clear off-ramps as people get vaccinated.
Do you think parents are going to do this? Do you think parents are going to vaccinate their kids? We're talking about 28 million kids between 5 and 11.
I mean, I think if you look at the data on adolescents and the lower uptake in that age group, I think we're going to see some hesitancy from parents, which I think we should respect and acknowledge. And this is why, again, you need to have a good conversation with your pediatrician to discuss your particular child and risks. But again, I am strongly encouraging vaccination for my patients who have children ages 5 to 11, my family members, my nieces, and nephews, because I do think that the vaccination is the path forward, the way out of the pandemic. But I think there's going to be some concern. And again, I think, we need to respect people's questions and not assume that people who have questions or who want to wait are anti-vax. It's appropriate and normal in the scientific process and then in the public to have questions.